Did you know that the number of adults in the US aged 65 and older is expected to reach 80 million by 2040? Given that 1 in 10 older adults have dementia, we can project that by 2040, there might be 8 million people living with dementia in the US. This is why it's more important than ever that all clinicians, including primary care clinicians and specialists, are prepared to identify, diagnose, and treat dementia. Together, we can make a difference. My name is Anna Chodos. I'm a geriatrician and internist focused on dementia care. Our goal with Dementia Care California is to provide clinicians and caregivers a roadmap for detecting, diagnosing, and treating dementia. So to make sure we're all on the same page, let's begin with the discussion of what dementia is. At its core, dementia, or what the DSM-5 now terms major neurocognitive disorder, is when a person exhibits acquired cognitive decline severe enough to cause functional decline. Functional decline is when a person can no longer perform certain daily activities, like dressing themselves, making meals, and paying bills. What's key here is that 1, the person used to be able to perform these tasks, meaning there's a decline from their baseline, and 2, the functional decline is a result of a decline in cognition, not another medical or psychiatric condition. Okay, so what do we mean by cognitive decline? All our organs change with time, and the brain is no exception. Everyone forgets their keys once in a while or forgets an appointment, so this could just be normal. The challenge for clinicians in diagnosing dementia is to differentiate between normal cognitive aging and abnormal cognition that may indicate dementia. Normal cognitive aging can look like being a little slower at recalling names or finding it more difficult to multitask. Normal cognitive aging might also look like getting better at certain things, like emotional regulation, or being able to sort information for what's relevant and what's not. So how do we know what abnormal cognition is? Well, these are cognitive changes that aren't what we expect to see with age. We often think first of memory as a hallmark cognitive domain that becomes impaired in dementia. But it's important to recognize that the DSM-5 definition of dementia points to a decline in 1 or more cognitive domains. The 6 domains are learning and memory, complex attention, executive function, language, perceptual motor control, and social cognition. Again, as clinicians, we're trying to identify cognitive decline that's acquired and severe enough to affect function. Another key characteristic of dementia is that it's not one specific disease. The DSM-5 categorizes it as a disorder, or we might say syndrome. This means it's a collection of symptoms due to an underlying disease or condition. There are many neurodegenerative diseases that can cause dementia, but only a handful are the most common causes. And they are Alzheimer's disease, followed by vascular, Lewy body dementia, and frontotemporal dementia. People can have more than one of these diseases simultaneously. For example, Alzheimer's and vascular dementia commonly overlap. Because there are many causes of the clinical syndrome of dementia, diagnosing dementia can be confusing. And what's also challenging is that we can recognize the syndrome, but it may take us longer, or we may never actually be able to diagnose the underlying disease. But there are a series of steps you can follow to effectively screen and diagnose dementia. For example, you may have treated many patients with heart failure. You probably recognize the clinical syndrome of volume overload, identified cardiac dysfunction as the cause, and then ran tests to determine the underlying disease, ischemic heart disease, cardiomyopathy, etc. We use that same process in dementia care, and our tests for determining the underlying disease are improving and evolving every day. Fortunately, there is a lot we can do for patients and their caregivers when we recognize the syndrome, even when we don't know the underlying cause, especially when we work across healthcare disciplines to provide comprehensive and holistic dementia care. At this point, you should have a basic understanding of what dementia is. Dementia is a syndrome most often caused by one of many neurodegenerative diseases. It presents as cognitive decline severe enough to be affecting function, and it's acquired. Symptoms are new and progressive. You should also understand now why so many diagnoses get missed. It can be difficult to distinguish between normal and abnormal cognitive decline, especially when symptoms are mild. But yet an early diagnosis is so important because, as you'll see throughout our other videos, An early diagnosis is going to provide the best possible outcome for people with dementia. In the following videos, we'll talk more about screening for, diagnosing, and managing dementia.